and start this. You guys do this. Hi guys, welcome to our channel.
And you are watching
Lifelines. So on today's video, we're going to be featuring two male nurses, Kyray and Parker. You guys want to introduce yourselves?
My name is Kyray. I'm a male nursing student in my senior year. I am currently interested in emergency medicine, ER, ED, whatever you want to call it. That's what I want to focus on when I graduate. So.
Very good, very good. Okay, King.
Hey guys, I'm Parker. I'm also a senior nursing major. I plan to go into trauma ICU nursing after graduation.
He wasn't playing. Oh, he wasn't playing.
I see you.
I see ya. So we're going to ask these two young gentlemen some questions about their experience working as a nursing student, essentially, and future going into nurse and how their lives are. So,
Why did you guys choose emergency medicine and trauma? I see.
I want to take care of the sickest of the sick. I want to take care of that mangled patient. As not so good that sounds, like it's very unfortunate that whatever may have happened to that patient happened. But I think the biggest thing that I want to gain out of it is watching the progression and knowing that I played a part.
Yeah, that's not easy.
Even now, I've seen patients. Right now, I work for the entire hospital, so some days I'm in the ICU and might not be back there for 4 months, 5 months. I've seen patients from the first day that they were admitted to four months down the line where they're working with physical therapy in the hallway, walking again. When they came in, they were intubated, sedated, in not so many words, a mess. And then knowing that even though I'm only in tech right now,
not just only in tech. We do a
I
lot.
I know. But
that techs, they do run the building.
Yeah.
Just let
Don't
y'all know.
disrespect your
Hospitals,
CNA, your tech.
everything in the hospital will fall apart without the tech.
That's very true. You can see it
but
happen.
just knowing that I played not so big of a role at the time, but then hopefully in the future stepping up and taking charge for that patient and getting more involved.
I see you as ICU nurse.
We gonna be right there. Me and Parker, we gonna be
Y'all
together.
know their stuff. They're like, oh, run that. They're sharp with it. The reason I think I chose emergency medicine is because, as y'all can see, I have a lot of energy. I've always had a lot of energy since I was a little boy. I always need to be doing something. I always need to be like just off
like
10.
that fast
Off
pace.
10. I'm not on 10. You know I'm off. And that's very rarely I'm off. So yeah, emergency medicine. I feel like it would give me that fast pace. Patients coming in, trauma. I see trauma cases. I see people that just having heart palpitations or whatever. Like you see a wide variety of things, and they say people in the ER are the jack of all trades, master of none.
Oh yeah.
But I think if you really want to concentrate on something and you want that to be your passion, you can become a master in it. You don't have to stay in emergency medicine. But I like that fast pace a lot, so that's what I'm looking forward to.
How did you guys meet us?
Reverse?
Sure, I'll go first. So I met Ricky and Priscilla in our first ever clinical rotation. On the first day, we all got paired up together. It was very interesting. Kyray I've known since our sophomore year in nursing. We have a very good mutual friend, and then that sparked our friendship. So we've been friends for a while now.
I met Ricky here. She was on the unofficial welcome committee our freshman year because she was also a freshman, but somehow my door was knocked on for her friends to welcome me. So I met Priscilla here through a mutual friend that she was roommates with our freshman year.
So the next question is, why did you guys go into nursing?
So I don't have a definitive reason why I went into nursing, but I do credit it to my grandmother being sick when I was younger, and me helping taking care of her. I feel like that really sparked the passion in mine to help take care of people, even those that I don't know. So I would give that the credit of me wanting to be a nurse.
My story is also very similar. It's a little deep and personal, but growing up, I grew up in a family full of nurses. My mother's a nurse, grandmother's a nurse, aunt's a nurse, sister's a nurse. But when I was in 6th grade, my dad got diagnosed with a stage 4 glioblastoma. So our family essentially took care of him for the remainder of his days until I was in 8th grade and he passed away. So that's where I found my passion for nursing, and I carry that compassion with me as I continue my career in nursing.
Have you guys ever had an experience where in your personal life somebody was kind of making comments about you going into nursing, like a negative, sexist way.
And what did you do?
And what did you do?
Personally, I've never experienced that, at least from like my close friends and family. Everyone that I surround myself understand why I'm going into the field and that I truly have a passion for it. And me growing up in a nursing family, like I stated before, my mother was a nurse, my dad was a nurse, sister's a nurse, grandma was a nurse, aunt's a nurse, whole family of nurses. So I never experienced that.
I think pretty much the same. I really can't remember a time when there was something negative said about me going into the nursing field. But then again, I wouldn't be the best person to ask that, because when I'm focused about something, I want something, all that other stuff that ain't aligned with what I want, that's just noise. I don't pay that no mind. So there could have been a time when somebody said something, but it ain't good.
That's good to hear, because I would imagine like people, like what you guys talking about earlier about being a doctor and people questioning that people might have like commentary, but that's good to hear that you guys haven't had that experience in that.
We got other stuff to worry about than to worry about what somebody think of our profession.
Exactly. All right, so next question. Did you guys have any like feelings towards nursing after you realized that it was like a very female-dominated career path?
I think in the beginning I was a little intimidated going into
It's okay, keep going, it's okay, it's okay, it's okay. This is the personality showing.
Not stuttering.
I think in the beginning I was a little intimidated to go into a female-dominated profession, but I can say honestly, I have not experienced any hardship throughout the program. There were a couple incidents with female patients that they did not feel comfortable with a male nurse, which is completely in their rights to request a female nurse. But other than that, I've had an overall pretty good experience.
When it comes to being in a predominantly female ran field, I didn't really have any intimidation because the majority of my family is female. So I was used to it. So it was just a new scenery, but it was the same familiar dialogue and yeah. So.
All right. So follow-up question. You were talking about how in certain areas you felt like you had a different experience being a male. Can you talk about those certain specialties?
Sure. So the one that really comes to mind for me is the maternity, labor and delivery clinical rotation we did. I was the only male nurse in our clinical group of 8. Our instructor was a female nursing instructor, and I was never allowed throughout the 12-week rotation, never allowed into the labor and delivery room, so I never got to see a birth. I'm not allowed in the OR to see a C-section. I spent most of the time in the NICU actually, which was a great experience. It was definitely...
Shout out to our NICU nurses. Hold on.
Shout out to
our
y'all.
NICU nurses.
Definitely y'all.
Exactly.
I was up there basically every week. They really embraced me up there. So I was very hands-on up there with the premature babies. But I never got to see a live birth. So.
Wow. And that's a big part of like that maternity rotation. Like you get to see a live birth and you're part of that. So I'm sorry you had that experience.
Yeah.
Me on the other hand, I didn't get to see a live vaginal birth, but I was fortunate enough to see a C-section. Actually, these two were in my clinical group. These two right here.
Shout out to Professor Kiana.
Yeah. So yeah, I did have that experience, and I don't really ever feel any disconnect because I am a male. There are other reasons why I could feel a sense of intimidation or a sense of not belonging, but I don't really think it had anything to do with being a male, because in this day and age, like, you see more and more male nurses arise and come to the scene, and we're here to take over. Not take over from y'all, but we're here to do our thing.
So do you want to speak more on that experience that you've had of why you might have felt disconnected if it wasn't being a male? Like, what do you think it was?
I said that wrong. I don't want to say experience, but I want to say like intimidated. There are times where it was intimidated, and it might not have even had anything to do with the other person or the other party, but there are times when you become self-conscious about the way you look on the outside and the way you be perceived as being a black male. There are times when I go into a room with a patient, especially like patients who we deal with who are older, might have dementia or Alzheimer's, and they don't have it all the way there, and they get stuck in certain periods of their life. You never really know what to expect. So there are times when I walk in and I have my guard up because I'm like, I do not know what's about to go down. Thankfully, I haven't had any experience as of yet that, knock on wood. Thankfully, I haven't had any experience as of yet that reflected any of those things. But there are times when I become self-conscious and I'm like, wow, I hope I don't intimidate this person because of the way I look, or I hope I don't come off as the wrong way because of that. But
I think the biggest thing for me is I always want to make sure my patient is 100% comfortable with me performing their care.
Right.
So there has been situations that have arose either in clinical through school or at work where the patient may or may not feel comfortable with a male being present.
Right.
So I think at the end of the day, that's what it comes down to me, for me, is to make sure that my patients are 100% comfortable and know that I'm providing the best care that they can receive.
Right. And I feel like in all of us, like no matter your religion, your skin color, or anything like that, you're still like disadvantaged in a sense.
Right, at some point.
Right. So let's segue into privilege now.
Just based off of like your gender, sexuality, race.
You don't
you
get
can't
it.
go up because there's a ceiling.
The like hierarchy of the hospital
Right.
will cap you at like, let's say an assistant nurse manager instead of the manager.
I think the glass elevator is just kind of like the opposite. Like, whereas glass ceiling is like women or women or minority groups kind of face that like
we get the glass
barrier.
ceiling because we go all the way up.
Yeah, with the
Oh,
elevator,
that way.
you guys go all the way up, and you guys are automatically seen for like promotions because you guys are in like a
I was just
predominantly
saying, I've
women
seen a lot of
field.
guys,
Yeah,
CRNA,
My nurse,
They
the
don't
person
stay
that's
for
above
long.
my nurse manager is a guy. I think the head of nursing isn't a guy at my hospital.
The head of nursing is a guy. Dad was a nurse executive, worked his way up from staff nurse, went back to school, got his master's, back to school, got his MBA, eventually got his PhD.
Talking about a man about that.
So he worked his way all the way up. When he passed, he was the vice president of nursing. He worked closely with Magnet, and he was also the chief editor of some healthcare magazine.
Oh, that's so nice.
Yeah.
Oh, he's really living his legacy out.
Yeah.
So with that all being said, how do you guys feel, or do you guys feel like you've benefited from that glass elevator concept within nursing?
I don't think I've benefited so far because technically I'm not a nurse yet and I haven't graduated. However, I have seen people in positions that I will soon probably be in, and I can see how they have benefited from them being males and having the same qualifications as the other females.
Yeah, I think one of the biggest things is that we are the few right now. That is changing. There is an increase in male presence in the nursing field. However, right now we are still the few. So I think we stand out more, not based off of skill necessarily, but we definitely stand out more. So, and like sometimes there are those scenarios where they do call on a male to take certain patients or handle certain situations that maybe a female nurse on the unit does not feel comfortable. And that goes back to the whole patients being comfortable with who's providing their care. Like there's definitely some male patients that only want a male nurse. So like it goes back and forth.
Like I am one of the very few techs on my floor for my shift that is a male, and anytime somebody needs to be lifted in bed, anytime somebody needs to be pivoted, anything that has to do with heavy lifting, I'm called. I don't mind, but they do call on me. And it's not that other women can't do it, it's just that you're a guy, you're the first one. I do think there is a discrepancy in men in power and the way we're treated in the healthcare field other than women. Because the first thing I get when I go into a room with a patient, oh, are you my doctor or my nurse?
Right.
You know how many
I've
times
already
I've been
been-
called,
Yeah.
oh, it's the resident, or
Yeah.
oh, it's the doctor coming in to speak with me.
And I'll have to keep reiterating, I'm your tech. I'm just a tech. I don't get paid that much. Thank you for the compliment. And then women will go into the room and it's like, oh,
My nurse is here. My nurse is here.
my nurse is here. It's automatically
Yeah.
nurse.
Yeah.
Doctor in a white coat. And because she's a woman, she's not a nurse all of a sudden. Or I get the question, why are you not in med school?
Yeah, this question.
Yeah, I don't answer
Why not
those.
just go to be a doctor? Why
Right.
not just go to be a doctor? I've gotten that question from my own family.
I don't answer it.
Yeah.
I don't answer it. I just
Right.
smile.
It's all about personal preference at the end of the day. As soon as high school out the gate and taking all them sciences, I almost died with them freaking prereqs. I hated them prereqs. You didn't like I didn't like anything.
No, that's what she always trying to catch me. Like, go ahead, sorry.
Go ahead, sis.
I didn't like the prereqs in terms of them sciences and all that. Like at that point, you're just taking classes. You don't realize like, oh, these are the classes I need to get into nursing school. And I didn't start doing better academically until I got into my nursing classes because I actually cared about that. So it's just like if you came out the gate 18 years old doing that sciencey thing, that's all you're worried about. There's no motivation to go into the healthcare field. There's no actually seeing patients. There's no understanding healthcare disparities. There's no bedside manner, especially with that sometimes. Not
Well, I think that's what we're going to see a lot, especially with everything with COVID going on.
Yeah.
With the younger classes behind us, we were lucky enough to get those fundamentals down, the bedside manner, even like changing a patient, changing the bed.
Oh yeah.
Like just those basics. Like I was having a conversation with a group of underclassmen the other day, and right now they're all applying for externships and summer jobs, and they're like, I have to go into this job and be like, I've never done these fundamental skills.
And it's so hard. You don't even realize like how serious it is
Yeah.
with changing a bed.
And how comfortable you could feel also on that floor once you know how to take vital signs, change a bed. Like you don't have to rely on somebody to help you out. Like you just know that, okay, they need to be changed. Okay, I got that. Versus like, where's the nurse? Where's the other tech on the floor?
And I think I could speak for all of us now that we're less than 2 months from graduation. Let's go. It's been a long ride, but I think I could speak for all of us now that we are so comfortable in our skill set that we can't wait to graduate and go to the next level.
Cannot wait. It was a long while. I would say starting my junior spring, where I started to become nervous, like to the point where I would be nearly petrified of me becoming an adult and graduating and being responsible for people's lives, like literally handing out medications that could potentially harm or help them, and being in charge of assessing and being able to point out different things with patients and being able to catch it before it even happens in some cases. And now I'm getting to a place where I can finally embrace that, like, I've earned this, I know more than I think I know.
Right.
And we're gonna do this. We're gonna do this.
That's
We're
all.
gonna be doing it and doing it well.
You
We're
guys
doing
put
it
us out
and doing
there.
it well.
Put us out.
So since you guys are about to finish up nursing school, what is some advice you would give male nursing students?
Advice I would give to a male nursing student is, and whatever you do, and I'm gonna give this to myself too as being a male nurse.
Period.
But and whatever you do related to nursing and in life, just do it with confidence and trust yourself and your gut and what you know. Now that's not saying act recklessly and just go, oh, I'm gonna do it because I'm gonna do it, or I think that's right. Like have some type of knowledge behind what you're doing. But if you're gonna do it, you gotta go 100%. That's what I got.
My piece of advice was, don't let those invisible barriers stop you. Like, get hands-on, get involved. Like, don't worry about what other people are thinking about you. Get involved, do your best, give it 100% every day you go to work or clinical. But just don't let those like stereotypes or barriers stop you from achieving what you want. At the end of the day, we are in this program for a reason, and we are here to succeed and move on. And I think that's the best thing, is to not stop and just keep moving forward and jump over those barriers.
And that goes back to me saying how that intimidation I might have, or that thought in the back of my head when I go into a patient's room because of the way I may look, like I should never let that stop me or make me feel some type of way, because that can get in the way of therapeutic communication with the patient. That can get in the way of me just providing good care for a patient. So I should never let anything deter you from doing your job, and that's caring for your patients.
What is something that you guys have learned from women in nursing?
So I think the biggest takeaway I've had from the women in nursing that I've worked with is their therapeutic communication skills. I believe that I've had great role models throughout my clinical experiences and work experience, from observing how the women on the unit communicate with their patients. I feel like there's a deeper connection with compassion and empathy sometimes that men may see as a barrier with their patients. Overall therapeutic communication, I think I've really taken that, observed that, and been able to apply that to my own practices.
I have to agree. Many women, I think, not all, but many women are already set with a nurturing disposition. Like they are just naturally that nurturing person, and they just come off that way. And like everyone has a mother. You might not like your mother or whatever, but everyone has a mother, so it's easier to connect. I feel like with a mother, well, with a woman in that type of setting, especially when you need someone to nurture you, because that's the whole reason why you're in the hospital in the first place, because you need someone to care for you. So seeing a woman in that position is definitely a big advantage because you already feel that sense of connection and comfortability. Not saying men can't be therapeutic in their communication, but sometimes with conditioning and everything, it becomes a little bit harder to connect with certain groups of people. So I think definitely y'all are blessed with that therapy.
So that's the end of our questions. Thank you, Kyray, and thank you, Parker, for taking the time to talk to us and sharing about your experience being a male nurse, or soon-to-be male nurse, I should say.
Woke male nurse.
Whoa. These are two very fine, educated,
Okay.
hardworking young
Okay.
men.
Okay.
Young
We might
girl.
just put their socials in the description box just for you guys to check them out.
Down below.
Just for you guys to check them out.
So be sure to like, comment, and subscribe. And I know you see that notification bell, so hit that bell. So you can see every time that we upload a video.
Alrighty, I guess that's all we have. So, deuces, guys.
Lifeline.
Live.
Before this video over, I did want to give a shout out to the maker of this hoodie.
Woo!
My man's. How they gonna hear me, Ricky, if you over there back there hollering? She ain't doing nothing to hollering. That's always Ricky. If y'all hear somebody hollering in y'all hospital, y'all know it's gonna be Ricky. Hollering for nothing. They ain't doing nothing. Anyway, yeah, my man Sammy, he made this hoodie. Sammy Shacha, he got other outerwear. Catch him. I'm gonna put the link in the bio. They're gonna put the link in the bio. They're gonna put all this information. You can catch him at. Support black businesses. Thank you.